Hey guys, it's Kelby Hightower. If you did not watch the first video, the myth of Medicare Advantage is always better than the original Medicare, I'd encourage you. There's a lot of information. Go back and watch that. The second myth, though, is one that's extremely important for you to understand is, does Medicare cover everything? A lot of times people are saying, hey, my Medicare will cover that, or hey, they just assume, they make an assumption that it's going to be covered, and then when they begin to experience it, they realize, oh, I thought that Medicare would cover this, and then they find out Medicare does not cover it. So you need to be very aware of what Medicare covers and what it does not cover. And in this video, I'm going to uncover some myths about some things that Medicare, you may think Medicare covers, that they do not. Stick around, I'll be back in just a second. So no one wants to have unexpected medical bills, you and me. You know, if you go to the ER, all of a sudden there's an unexpected medical bill. In my world, for my wife and I and for four children, we've had unexpected medical bills at times. Sometimes a child sprained a leg, an ankle, or fell and broke an arm, and all of a sudden they're at the ER, and I'm getting a big bill to have to pay for that. So I want to be able to cover some things that you may face that are unexpected medical bills if you believe Medicare is going to cover everything. I want to explain really what Medicare covers when it comes to hospitalization and some doctor visits, so you kind of have a baseline, and then go into what it does not cover with you. So hospitalization, Medicare is going to cover hospitalization. If you're on original Medicare, you're going to have a deductible, and that deductible is applied each time you've been in the hospital and been out for an entire benefit period, which is 60 days. So you go to the hospital, and within that 60-day time period, if you come out of the hospital and get admitted back to the hospital, you don't pay the Part A deductible again. If you go back into the hospital after those benefit periods, guess what? You're paying the Part A deductible again. So somebody that's chronically ill or suffering with something, maybe like cancer or a disease, and they're overcoming that, maybe a year or two process to overcome maybe a very traumatic health situation or a chronic illness, and they're trying to stabilize that illness or stabilize the health condition, they may be in and out of the hospital 3 times during that year, and they're subject to the Part A deductible. So that's kind of the worst case scenario. But, you know, looking at the Part A deductible, it can be several thousands of dollars of cost you have out of your pocket just for the Part A deductible. And then we're looking at the Part B cost. The Part B has a deductible and it has co-insurance. Depending on what year you're in, that Part B deductible can be less than a few $100s a year, and then you're paying 20% of the billable rate. So you need to realize that, you know, Medicare does not cover everything. And tragically, what will happen a lot of times is we've seen people go and have procedures done, and all of a sudden, when they start getting the bills, it's overwhelming, because this doctor bills this and this facility bills this, and you have a facility cost and a hospital cost and a doctor bill and then lab work, and all of a sudden you have this pile of bills that you're having to pay, and you're trying to keep up with where and why am I having to pay all this. And you need to understand that Medicare does not cover everything. You have some responsibilities for Part A and Part B services. So if you're looking at what health plan you should go on, you should understand that if I stay on original Medicare, I'm going to have some costs at some given point, and it could be astronomical. So what are my options of looking at a Medicare supplement or Medicare Advantage plan, or if I stay on original Medicare, that's your choice. What are your risks and exposures when it comes to that? And clearly, one of the big things that Medicare does not cover, and a lot of times people are confused about this, is like dental, vision, and long-term care. So I want to break these out kind of in the dental department. Now, if you are an elderly person, you're walking down a flight of stairs and you fall, and during that fall you fracture a hip and you hit your jaw and it busts something, and that happened medically, like a surgery to fix your jaw and the teeth involved in that, that's going to fall under Medicare Part B services as a medical. But if you go to a dentist and you get a cleaning, and all of a sudden during the cleaning you don't have dental insurance, and the dentist says, hey, you have a cavity and you need to have this cavity filled, and you say, well, I don't have insurance, what's that going to cost me? Or you need a crown, extraction, filling, crown, root canal. All of a sudden now you have this absorbent cost that Medicare does not cover. So Medicare will cover medical conditions, and I typically give this worst case scenario: you fall down the steps, you break a hip. Are you going to do that? Maybe not. Has it happened? Have we had clients fall and have things happen where they hit their face? it knocks something loose, they have to have surgery, and a tooth is fixed during that surgery, or repairs done to the jaw, or dealing with the teeth because of some traumatic event like that. Yes, we have had that happen. So Medicare Part B is going to cover some of those items, but then outside of that, if you go to normal, routine, preventative, and comprehensive care for dental, Medicare does not cover it. And then looking at the vision. So if you're going to a Medicare, a doctor that's contracted with Medicare for a specialist, and you're going in for a condition of the eye, then Medicare is going to cover that, and it's going to be Part B deductible, 20% of the billable rate. If you're on a Medicare Advantage plan, guess what? You're going to pay probably a copay. But the problem is, original Medicare, does it cover everything? It does not. If you go to get your eyes examined, just a routine eye exam, it has nothing to do with conditions of the eye or glaucoma screening, that Medicare situation is not going to cover that eye exam. Also, if you say, hey, I need glasses, and my glasses are $600 because I have, a certain eye condition that requires me an expensive lens, Medicare is not going to supplement or cover any cost of that. Also, if you enroll into a Medicare supplement, a Medigap or Medicare supplement, Medicare and Medicare supplements do not cover any preventative services when it comes to eye care. So routine eye exam or covering eyeglasses, Medicare is not going to cover that. And you just need to be aware that, hey, if you do that and you choose to stay on original Medicare or original Medicare, Medigap or Medicare supplements, you're not going to have eye coverage. And then eye coverage, typically premium-based eye coverage that you're paying for standalone eye coverage, it's usually not worth the premium you pay to get the benefit back from the plan. So you just need to be aware of what you're paying out. That's the same reason why a lot of times people look at a Medicare Advantage plan, because it will cover routine eye exam. It will usually pay an allowance of $200 or $300 for glasses, and it reduces the cost if they have conditions, if they're worried about getting their eyes checked and want to have that covered. The Medicare Advantage plans typically, normally most of the plans will cover that as part of one of the benefits of the plan. The other one I wanted to focus on is long-term care. So long-term care can be confusing because Medicare covers up to 100 days. And so if you're in a skilled nursing facility, the first 20 days typically is rehab. Skilled nursing facility rehab, you're going through, you fell and broke your hip, you had surgery, you're going to have to be in rehab for 5 to 10 days, and all of a sudden they turn that into 15 days and you stay. And then you're released. Well, let's say if you go beyond the 20 days, you're not recovering, you've lost basically daily functions of ADLs, like getting dressed, toiletry, feeding yourself, and while you're in the skilled rehab, you have a light stroke, and now all of a sudden you can't walk, and you're having a rehab, and now all of a sudden it's turned into another condition, and now we get into 100 days and beyond. This is when Medicare stops paying, and then you begin to self-pay, or if you have long-term care insurance that you've actually paid for, that begins to pick up at 101 days and beyond. So Medicare Advantage plans, Medicare supplements are going to pay up to 100 days, depending on what plan you have. The 100-day mark is the benchmark. Before that, most of the cost is going to be covered by whatever plan you're on. You may have some copay costs after so many days, and that can be explained on a different video, but that we do on skilled nursing. But you're going to have some cost involved, but it's not going to be 100% cost. Now, once you get to 100 days and beyond, the long-term care needs is a self-pay, or you have bought long-term care insurance prior to having this facility issue, and now all of a sudden your long-term care insurance policy is beginning to pay out for your long-term care needs. And that could be in a nursing home, that could be in assisted living. It applies for depending on what your need and level of care, or you can go transition back home. But beyond 100 days, you're going to have some cost or another insurance product that's going to pick up the cost for you. So let's discuss just options for supplement with other insurance when it comes to like Medigap or Medicare supplements, Part D, or prescription drugs. There's another thing a lot of times people are confused about when it comes to Medicare covering everything. They all of a sudden will say, okay, what's going to cover the deductible, this 20% amount that I hear about? And that's where you have to either A, choose to enroll into a Medicare supplement, pay a premium each month. That average premium for most of our clients right now can range from anywhere from about $100 to about $120 a month. If you're looking for like a plan G or a plan N, it could be a little less depending on the state that you're in. We'd say call, set up a time, let us look and quote and give you some options of what's going to be the best option for you. But you're going to have some costs involved, and you need to be aware of how do I fill the gap of that with a Medicare supplement, or if I enroll into a Medicare Advantage plan, what is my cost out of pocket when I access care? Because most Medicare Advantage plans are going to have zero premium in most markets, or very low premiums, and then you only pay if you use the plan. Sometimes the entry level, like preventative services, your primary care doctor, things like that, you're going to have zero, very low copay. And then if you access for like surgery and things like that, you're going to have a little bit higher cost. So this gets into Medicare covers everything. Again, we're looking at the myth and kind of popping a bubble when it comes to this myth is Medicare is going to cover prescription drug coverage. Now, Medicare does not cover your prescription drug benefit. So if you're getting medications filled at a pharmacy that a doctor's prescribed to you, you're going to have to choose a prescription drug plan based on your formulary or the medications you're taking, and have somebody look and review that with you. I would say call us, let us review your prescription drugs, or you can enroll into a Medicare Advantage plan that has a drug plan. That's going to be called a Medicare Advantage Prescription Drug Plan, an MAPD plan that covers drugs. So PD means prescription drugs. And that's very important because sometimes you're coming into Medicare or you're past the age of Medicare, you're confused about what is covered, you're not doing the research, and sometimes you don't even know where to turn to because there's so much information out here. And a lot of times people misguide you trying to sell product as opposed to providing a service of educating you on what options. So connect with somebody. We'd love to be able to help you with the situation. If you have questions, we can always answer the questions. But Medicare does not cover, and there is a myth that Medicare does not cover everything, and one of those big things is prescription drug coverage, and that can be hundreds of dollars a month, thousands of dollars a month if you do not have the proper drug coverage. All right, guys, so I want you to stick around, check out the next video in the series, the Myth 3, I can enroll in Medicare anytime. We're going to really walk you through exactly when can you enroll in Medicare, and then eliminate you from thinking I can just change or enroll into Medicare anytime that I want. I'll be back in just a few and see you guys on the other side.